Okay, thank you. Go ahead and get started.
Thank you so much, everyone, and thanks for the great introduction. I will quickly introduce myself and give you a little background of what I have been doing and what I'm doing at present and how and what we would be discussing today. As Dr. Kent mentioned, I was Dr. Kent and Dr. Taylor's student back in 2007 to 2009 at University of Oklahoma. Before coming to the University of Oklahoma, I was working with the government of India on work around tourism, public relations, and communication. And that's when I decided I should really come and study public relations more from a strategic dialogic perspective. And it was a very well-researched university where I knew Dr. Taylor and Dr. Kent were teaching, and they were professors that I applied for that school, and I did my master's there. And as Dr. Kent mentioned, I took a lot of classes with both of them, and my absolute focus was to work with them and understand communication from a strategic perspective. And that's the reason, instead of joining and going ahead with my PhD, I took a break. I went back to India, to Bangalore, which is the IT hub of India, and I worked with Burson Marsteller. I was in the technology practice. I worked there for almost 3 years. And when I thought that I was ready to really come back to the drawing board and understand and apply those learnings to theory and understand theory from a different lens, that's when I applied and came to University of Florida and did my PhD there. And after my PhD, I decided not to join the academia. And the reason was because I really enjoyed the agency and the industry, and I really liked the pace of it. So I thought I was made for that pace of things, and I really wanted to explore. So I joined another agency called APCO Worldwide. I worked there for 5 years, worked on all the amazing clients you could imagine. And then I got an opportunity to work with Kaiser Permanente, which is one of the leading healthcare insurance provider. It's a very hybrid, very unique healthcare system and a model. And I am a director of comms in the national communication now. And going back, I know some of you are students of Dr. Kent, and if I could give you one advice, is spend as much time with Dr. Kent as you can, because that's what I did, and that really helped me. I would literally sit in his office while writing my master's thesis and ask him questions and have those discussions. And I remember how kind he was to get me lunch every other day, because I would be sitting in his office working on my thesis all day, and they would always offer to buy me lunch, and really took me under their wing. So a lot of what I've achieved, I feel very proud of the fact that I owe it to them. Has it not been for that very good understanding of comms and that drive to really study it further, I wouldn't have come back to do my PhD. So I really feel so proud that I got an invitation from Dr. Ken to come and speak to his class, because that says at least that I have achieved something in my life to be considered as a guest speaker. So I'm very proud today, more proud than Dr. Kent might be, but and so excited to be talking to you as well. So talking about the topic today, one of the things when I was talking to Dr. Kent about what would really benefit not just the students, but a good discussion to have is about research. But since I'm coming from an application or an industry perspective, how are communication functions really using research in the comms function? And that's something which I thought I could share some examples with you. And the other area I thought would be really interesting to discuss today with the group today is this increasing research on the topic around behavioral research, and how communication functions are really looking at that as something which future communicators should understand and apply. And I think that's where I really feel that the session today would help some of you think about your research interest and maybe pivot a little bit, look at the intersection of those things, but also give you new ideas around research and what's happening around the world right now as well. So talking about that, one of the things that I thought I would start the conversation and probably get the ball rolling are some questions. And that would also help me to understand what your thoughts are and what you think is happening or what your perspective is. And I would love to know it from anybody who's on the call today. If anybody could just share your thoughts on how you think organizations are using research in comms PR, or if you have an ideal state where you think they should be using. I'm happy to listen or get your thoughts on either of, or how do you think they're doing or how they should be doing. If you have thoughts, if you have ideas, let's start discussing, because I definitely don't want this session to be a lecture, but more of a discussion. And that's what I've learned from Dr. Kent. It's a dialogue after all, you have to listen, you have to participate. So I would love to hear your thoughts on that. So anyone with any ideas, any perspective on this?
If I may, we always say that the research is obligatory. It's very important. So you can't do any communication without research, and nobody will say something contrary. But in real life, when you have a real communication campaign, so usually people who makes decisions, they're trying to save some funds, and they say, well, yes, of course, this is very important research, but not this time. Yes, and especially as I told you that I'm from Ukraine, and we had a very we usually look at the examples from other countries, and sometimes it's a pity when they, I don't know, USAID, for example, United States International Development Agency, yes. So they came, they opened the very large program, they put a lot of money inside, but they didn't, how to say, plan. They didn't requisite enough funds for research, and that's a pity. So I don't know, maybe it's like a little spontaneous.
That's an interesting perspective. And I just want to get your thoughts, because I really want to then share some examples of research that we have been doing and implementing. So that's why I'm asking this question, to get your thoughts on how you think organizations are using, or if you think they're not using, how they should be using, if there's an ideal state. Any other thoughts or perspectives around that?
I think one way is through hiring consultants, or as we know, research is finally summarized in textbooks. So what we teach students in classes is a summary of research. So by hiring PR, like graduate PR graduates, or PR consultants, for example, when a crisis happens and organizations really know what research says about their situation, they hire consultants.
Okay, I would like to share some of the things that I discovered in my research. I interviewed some public health professionals and both communications and program professionals, and I discovered that most of them, they face structural issues within their organization. So, and research is the last thing on their mind. I mean, they don't get an opportunity to explore their field work. They don't speak with their participants. So I don't know about how agencies operate, but public health organizations, they find it very difficult to conduct research because of several structural issues. That is what I discovered. Yeah.
Thanks for sharing that. Any last thoughts or comments on this? Perfect. I think one of the, yeah, go ahead. Was somebody adding something? I don't want to cut somebody off.
Maybe somebody
Okay.
started talking. Chris, was that you?
Yeah, sorry about that. I'm just controlling my mute.
That's
So
okay.
I just want to add one comment that before I leave my practice, then usually the organizations use the research for their persuasion purposes. For example, when launching the new product, new services, how their mindset to lead the consumer's mindset. That is the one motivation they starting off the research, right? So I'm not quite sure. Maybe 5 years passed already. So what kind of changes happened in the organization perspective? But usually they just want to have some persuasion purpose.
Yeah. Okay.
Based on my experience.
Thanks for sharing all of that. I think one of the things that you were, some of you were mentioning, there were mixed responses there. One response was around how communication research comes in the end, it's not something which is done. It's like an afterthought. I think Bhupesh mentioned how there are structural challenges. That's what does not help or enable the organizations to conduct research. And Chris, what you were saying was more around the market research. And that's where we don't understand that there are two different bodies of research in an organization. Every organization, despite whether they're a consumer brand or they're healthcare or whatever, they have a market research function, which is very robust. And most of the big organizations have that. So when it comes to launch of a product or when it comes to all those decisions, the market research function would always conduct that market research. But when it comes to comms research, the challenge with comms research is that the people or graduates, when they join, the function is still so tactical in nature that all the time you're just sending out a press release, getting a media coverage, getting an op-ed, think about a speaking opportunity. So it's still not however we would want it to believe it's the case, but it's still not at a point where it's data driven or strategy driven comms. A lot of that is so tactical and so operational that's why the research doesn't come in. But that being said, the things are shifting given if people like the PhD students in this class, if you join an organization or if you become professors and you start consulting with organizations, the kind of perspective you could bring to communication. And that's what I am doing now as part of a big organization. I'm situated in a comms function, but given my training in research and my understanding of communication as a strategic function, I'm trying to bring that change in saying, let's just take a pause for a minute. Let's look at what our stakeholders are saying. I know we always say ideally we would want to listen, but we don't have the time. Sometimes we don't have the tools to do it. Sometimes we don't have the budget. But to be very honest, the basic reason is that most of the times the comms professionals don't have the training or the sophistication to conduct it. And that's a sad truth. It's not, they can get the budget if they want, they can get it approved. It's to get, even if you don't do primary research, I don't think doing secondary research is so hard, but it's just the nature of the function that you just start thinking about a topic and you just start making creative and campaigns around it without thinking about the research, the process there. And that's where I feel is a challenge. And that's where I think these lectures and these discussions are helpful, because in a way we are trying to have this discussion around how to bring research, even if you are a professor or you are a student or you are a practitioner or you are working, how would you really bring research more central to the function as well? And I will share some examples of how we are doing it. And I just wanted to explain research from the communication function. What are we doing, trying to do, especially not in academia, but in industry? And when we say research, the most important thing we are trying to do is to discover something. It could be what the media is talking about us. And that's why if you look at most of these metrics, they are around media impressions, media sentiment, media tone, number of articles. All these KPIs and metrics are around media, because a big part of the comms function still revolves around media, earned media, or now digital and social media. When we think about research from the industry perspective, mostly it's either to explore a topic, to describe a topic, but it's very rare that you want to explain or you want to really get into the depth of it. And that's a fact. It's more about, I want to do research about mental health, for example, because of COVID-19. The discussion around mental health is so important that we as a healthcare organization want to understand mental health. And somebody who would be a more sophisticated leader would say, why don't you just go and see what other campaigns are out there around mental health? And somebody would just do some secondary research, sit on their Google, look at their competitors, find if there is a campaign out there, look at the creative, come back and just put 2 slides there and say, oh, this is what somebody X, Y, and Z in our competition is doing. But they would not go thorough with it, because A, they don't have the time, they don't have the staff, and most important, they're not trained to do it. It's just something they would add to look nice. And the other trend I have seen very common is often communicators would look at a PwC survey or a McKinsey survey and look at those data points to look nice. And they'll say a PwC survey says that 55% of the respondents want to read Facebook posts. So we are going to go and put everything on Facebook without thinking whether the stakeholders they have or the audience they have is the Facebook audience or not. So I think that's where is another mismatch. And that's where, the industry and we as a profession or as students should be thinking of how we think about it as a strategy and not just as a good thing to do and to have there. The other thing is, I really like this example, and probably some of you would have seen it. If not, you'll find it fascinating, because that picture and that story that I'm going to tell you explains exactly what the challenge is and where the academia and the industry differ in research. So this picture is from World War II, and these are examples of airplanes that would go into the war and come back with a lot of destruction on their fuselage, and all the damage that happened. So the Americans really wanted to understand that the planes that were coming back from their engagements from Europe, what was happening with them? Why? And they had to armor their planes, but if they would heavy armor them, they would take more fuel, they would become heavier to fly, and all those challenges were there. So they went to a group called the Statistical Research Group, where there was a statistician called Abraham Wald. He was a Jew who had fled, the miseries of the World War. He was in New York City, and he really wanted to understand. And there were other statisticians in the room, and they said, oh, I think, we should really heavy armor the fuselage, and we should definitely make sure that we covered the wings really well. We should add something here and there. And he was a guy who was brilliant and smart. And he said, I think we are missing a very big point. We are just looking at what we see in the images, but what about the planes that never came back? Where is the data point of the planes that never came back? And the challenge with that is that the planes that never came back were the planes that got destroyed at the engine. And that's why they never came back. So you're just looking at the wings and the fuselage and everything else, but you're not looking at the planes that never made it back because they just couldn't come back because the engines got destroyed or something. And I think what I'm trying to bring to the group here is that that's what often happens with research in industry or in general, that you really miss the bigger picture because you're so involved in the nitty-gritties, and I think this is the same example. If you go to a recovery room at a hospital, you'll see a lot of people with maybe bullet holes in their legs. than people with bullet holes in their chest, because people who got shot in the chest, never could recover or could make it to the hospital as compared to people who got bullets to their legs. So I think that's just a great example of how academia gets into the nitty-gritty so much at times, and I remember my times when we were writing papers. And I'm not trying to say that the p-values are not important or the reliability of the scale is not important or the validity is not important. And the same is with industry, where they would not look at the any theory at all. I think there has to be a middle path. There has to be a way where we say, let's understand what is the need and what is the bigger picture, or what is the question that we are trying to address. So I think every time I think about research, I think about this example, that really helps me also go back to my drawing board and say, am I missing a bigger picture? Because a lot of the work that I do now includes data. And I'll show you in a minute, an example of how we use that data, but I thought this could be an interesting one to share with this group here. Any questions so far? Any comments, anything anybody wants to add, or anything that brings some thoughts or memories looking at this picture? I know, there could be people who would have thought of something. Anything to add? Okay, we'll keep cruising then. Talking about research and why companies are doing it, there are numerous reasons, save time, money, understand stakeholders, make better decisions, discover new ideas, make data-driven decisions. And I would say that a lot of the work that we are doing in my organization, and what I saw in almost 8 years of my agency life and 3 years now in my in-house role, 11 years, is most of the times we are trying to either understand stakeholders or we are trying to discover new ideas. It's very rare that we are thinking about data-driven decisions or better decisions. It's mostly driven by, let me understand what my stakeholders are. And a great example, I think Dr. Kent would agree, because he does a lot of research in social media and digital spaces, how nowadays, with all the focus on the digital and social media, identifying those influencers is a big reason why companies would want to do some research, because they want to know who are the influencers they want to tap for their communication and for certain campaigns, and also understanding the stakeholders on that social media space as well. And I think that's a big reason why research is done as well. So moving on, I thought what better way than to show a COVID-19 news pulse, and this is something we did for one of the campaigns that I worked on and some work. So we wanted to understand, and I think before I move on, let's just take a pause and look at what has happened in the world, around the world, in the last year and a half or 2 years, and what that has really made a difference to the organizations and communication function as well. If you look at how from going every day to work and talking about employee engagement to suddenly being virtual completely, and I don't know how many of you noticed that all the research that was done before COVID was around the term called work-life balance. Every company would say, oh, we have the perfect work-life balance if you get hired, if you talk to an HR person. But now the term is no longer work-life balance. Does anybody know what that term is? Anybody wants to take a guess, or anybody knows what that term now is? The marketing spiel of the companies, it's work-life integration. It's not. So don't use the word balance, it's not balance anymore. It's work-life integration, because companies understand that everything is integrated. It's no longer that you're going and you have a hybrid approach where you work from home for 2 days and you go into the work office at 3 days. Because you are at home, there are no set boundaries. You have your kids to take care of, you have family. So everything is about integration. And any job you look for, any company you talk to, any thought leadership piece you read, it's about work-life integration. And I think companies are struggling also about it. And I can say for sure that if you look at healthcare in general, there has been some excellent challenges for communicators, because think about it for a minute. If you are a communicator and you have your members and your society, and you're telling them that COVID-19 spreads and looks like a flu, what kind of messaging would you tell them that how that differs, how COVID-19 is different from flu? What kind of messaging as a communicator would you tell people that they should get a COVID shot, but the flu season is around the corner in the US? What would that mean, as communicators? So there are so many unique challenges for organizations in general, but especially healthcare organizations, because they are thinking about the messaging, they are thinking about all the things and how that could really do that. So moving on, this is what an analysis or a data looks like. We use a tool called QUID. Its name is here, QUID. It's an artificial intelligence machine learning tool which does a visual representation of all the topics that are covered in the media. It clusters them together. It's like it's the methodology where they will make these network maps. So it's definitely, most of you would have seen something similar, but would not be as visually appealing, because this is a tool which makes it visually appealing. So when you look at this analysis, you see that it looked at the software looked at 3,000 unique stories in the 15 days time period. It colored it by clusters. So it says how much of the top clusters, if you look here in the top clusters, what are the top clusters? Hospital capacity concerns is a big thing. Health tech and digital solutions is almost 10% of the coverage of that 3,000. You look at the restrictions, you look at contact tracing, you look at mental health, you look at vaccine distribution, you look at case distribution, reporting, you look at all the patient experiences and stuff. And what it tells is that if you are a communicator who wants to understand what's happening in the earned media or the online media space, and you want to conduct research on where your organization is being mentioned in that bigger scheme of things, or where you can position yourself, that's where you have an opportunity to use research and understand that perspective. So this is not primary research. It's not going out and asking people. It's secondary research, but given how sophisticated tools are becoming, how analyses are becoming, this is one tool which enables organizations. And I've used this tool for a really long time in my agency world and now in-house, but it really helps us also then take a deep dive into, for example, COVID vaccine distribution plan. So if I want to look at all the, and for somebody who is not familiar with the technology, all these dots that you see are news articles. And the closer these clusters are, the more connected those topics are, and the more interrelated those topics are. So you'll see the hospital capacity concerns, which is a red-orange, very close to the patient experience and case reporting. And you see the mental health during pandemic and COVID research and studies, or the health tech as, again, more related to a vaccine distribution plan, which is all left far and would look at different things. So just a way to look at the data, but then you definitely go further and you say, I just want to look at, for example, hospitals and healthcare workers, and I want to understand what kind of coverage, what kind of conversations do we have, and where is an opportunity for an organization or as a communicator for us to have a stronger messaging so that that space is already not overwhelmed and it's not overcrowded. And that's one smarter way to look at the data. And that's how we think that when we look at the data, we could really say, I want to talk about COVID vaccine distribution plans. And since we are a provider and an insurance company, we are also a part of that vaccine distribution network. So we want to see what coverage we are getting, what are our competitors getting the coverage, is it positive or negative? But then more importantly, let's go a step further to understand where can I have a unique voice or a unique message out there as well. So this is another, and then we go further and look at, probably another deep dive, because at that time, the holiday travel was coming up and we were just looking at where that holiday travel would impact, because it was the end of November. So when you look at the holiday travel and you just see what are the hospitals' tips and suggestions for that, what is the Thanksgiving travel looking like, what are some general holiday tips and suggestions, and that's where we know that if 61% of the coverage is all about health experts and what are some tips and suggestions. And I'll give you another great example, because this tells us two more things. It tells us when we are talking to our internal employees, what kind of messaging can we really develop for them? What kind of content we can really develop for them as well? And if I am an employee, but also a general public, I would really be interested to know what I should be doing and be very cognizant of during the holiday travel, or if I'm planning not to travel, what are some tips and tricks that I should know, not just as a customer or as a member of a healthcare system, but also as a general public. And we saw that really spike when COVID started. We saw every Google search term, and I don't know if you know, but you could actually go to Google search and you can see their search trends for free. You don't need to have don't have to buy anything, or you don't have to pay for anything. You can just look at, in the last 10 days, what are people around the world searching for on Google. So we use that Google search trends to see, especially when COVID happened, that a lot of the people were looking at, because the N95 masks were not available, people were doing DIY cloth mask and how to make it. And that was the top search term for the longest time. So we quickly went ahead and created some content on how to make a mask. We put that across our websites, across our social channels. We took some physicians who could talk about the impact of wearing a cloth mask, the significance of it, and how we could really develop a comms campaign around safety and mask wearing and things like that, along the lines of that data that we were seeing. And then as we keep looking at those trends, we also look at, for example, when the flu season happened last year, because of the lockdown that we were in, no schools, the flu season was not as bad because people were home, they were not going out. And if they were, the mask mandate was there. But now this year, because the mask mandate is not everywhere, look at Florida and Texas of all the places, no mask mandate in schools, kids are back to school and all that stuff. The flu season is around the significance of a flu vaccine and how you could really identify whether you have a flu or a COVID-19 is such an important topic for us in healthcare. And that's what we have to really make sure that we keep looking at the data on every single basis to see how the search trends are shifting. And I'll give you another great example. When Delta variant started, we quickly saw that a lot of the search trends or the media conversation moved not just to COVID-19, but of course, COVID-19 Delta variant. So a lot of the content had to be shifted overnight to include Q&A and FAQs on what if you have a Delta variant, what is the efficacy of the vaccines that we are giving and providing against the Delta variant? What would it mean if there is a breakthrough case as well? So what I'm trying to explain and just bring with all these examples is, the more you really start looking at the data, the more smarter you get, and that data, that research doesn't have to always be primary research, which many of the people would say, oh, every time I have to go and ask and conduct a survey, or every time I have to go and conduct a focus group. It could be as simple as just being creative to see, can I just look at the media trend over the last 2 weeks to see what the media trend has been, what the media is talking about? Because communication for us is earned media, it's the news media, it's the social media, it's our website, it's our intranet, it's our member surveys, that member information, that so it's every layer of communication that could benefit from that research or that data as well. And I think that's where many a times I felt that people who are students, when they don't get to understand how the functions work, they think that probably just bringing a stakeholder engagement theory on the table would help. But I think you have to deconstruct and simplify to say, what would that mean to apply that stakeholder engagement, theory to the situation we are in? Like, I'm sure that if you really start thinking about it, you could, but I would say that's where I always hear when somebody would even tell me that you are too PhD and nerdy to be in comms because you don't understand and you just talk about research from a very different perspective, because the comms people have not studied research. So there is this big, gap which needs to be bridged, and it's hard at times because we are just racing against time. As I just told you, like overnight, you have to think about changing that content and, making those shifts. And we would definitely not have the time to say, let me just go back and think about a PR theory that I could apply in this situation, because that is something I would have thought about when I was making a strategic plan, for sure. What is it in my strategy? What is it in my plan for the year or 6 months or a quarter that I should be doing, and how I should be thinking about conflict or cooperation as a scale or as a methodology for my community and to engage with them? How would I think about license to operate in a community, in a society, and how that could really guide my strategy or my campaign or my work is the approach I would say needs to happen. And that's where we as a consultants or as communicator or as academia or even as people who are studying research so thoroughly need to come and say, these are the two things. And I'll tell you one secret about the people in organizations, and that secret is that they love to say that they are busy. That's their favorite thing. Every time you talk to anybody in the organization, they would say, we are very busy. So if you could give us 2 or 3 takeaways or 3 things we can do, they like those 2 or 3 takeaways always. Every time I've talked to my chief communication officer, she would say, oh, this is great, Sarab. Could you just tell me 2 things I need to know from all the analyses you did? And I've talked to my chief marketing officer and she would say, oh, I think this is great, but I really want to know what is your recommendation that we should do for our marketing content. And that's what I've learned in all these years. In an agency, when you go and present to a client, they would say, I love that you did all the research. Let's keep it at the back end for now and just tell me 2 things that how and what I could do with this. So my greatest recommendation would be if you could oversimplify and just take those data points and say, these are the 2 things you can do immediately, they would love you, because that's what they want quickly. And that's why they see you as an expert. And they don't want to get into your territory because they would like, just tell us 2 things that we want to know and we'll do that. And this is another example of how we also then look at some negative, neutral, and positive sentiment. We definitely see that because as an organization, we are promoting and protecting the brand of our organization. So we have to make sure that if there is a negative media coverage and it continues to escalate and become an issue or a crisis, it impacts our reputation. So we have to think about what are the negative coverage, how that's growing, what are some of the hospital capacity concerns that we are seeing in the media. And as an organization with hospitals and insurance and provider space, what should we be knowing and understanding? So that's another way we look at things, where this is like the heat map of where things are going good, where they're going bad as well. So I'll just pause here. I see there's a lot of chat and I can't read the chat because I have the full screen on, and that's why I'll definitely go back. Okay. Any thoughts from, or any questions that I probably didn't read? Any questions or any comments so far?
Well, actually, I would just say that I've seen this every time we've gone to an agency or met with someone who is in communication, is they have this sense that we need experts for marketing and we need experts to help with advertising, and we want to hire smart people, PhDs, masters, people with psychology backgrounds, and other kinds of things. But they think that communication is just some sort of magic bullet, like we don't need the research support, or that that it's not important to us, or that we can just take what they've gathered for a different purpose and do something with it. And even though maybe we can, I think they largely miss the power of what we can do, because what you're talking about here is, we can control the nature of those discussions. We can set the agenda. We can make them think about, the important issues. And that makes the organization's life easier, because then you are controlling the direction of things. You're having an influence on what people talk about instead of responding to something someone else raised.
And you know what? I'm okay with them trusting me. Like, as long as there's a budget for research and I have the time to do the research, I'm okay in distilling it down to 2 or 3 takeaways, right? Because as long as I'm confident in my understanding of the situation and that I've actually been able to have some kind of research, whether it's secondary research or primary research, I'm fine with that, as long as they give me the time and the budget so that I can make those data-driven, theory-driven insights.
That makes sense. And I think to Dr. Ken's point, that's exactly true, because the marketing functions have been so data driven. And the reason they have been data driven is because they have always been asked to prove their impact and importance for so long, and they have a hard metric to also measure and report on. And that's what makes it so important for them to go out and say, we paid so much money on the paid media, on the ads, so this is the return on investment we have. But every time the comms people are asked to prove their impact, we get to the softer aspects of things, where we would say, oh, we got this much media coverage, or it's very hard to translate into a tangible thing. And I think the industry still has moved a little bit further, but it's still not there yet to say we can absolutely show our worth. And that's why they would say, we don't have the budget to give you more to do communication research. Whatever you can do with your budget is fine. And that's the same with measurement as well. Like, if I look at the organizations around, measurement is an afterthought, or they would say, could you just tell me the number of impressions? And somebody would say, we had 2 billion impressions, and everybody's eyes would roll. They would say, oh my God, 2 billion impressions. That's like, you did so well. But, they don't know how that's calculated. And it's just a possibility that somebody would have seen. So the 2 billion is just the number of subscribers a newspaper has. And if somebody does not know on the call how they calculate impressions, they would just say, our news story was in 5 different places. And in that 5 different places, one publication has this much readership or subscription, and this much has this much. They'll all add up those, and they'll say, oh, so that 5 stories had the possibility that 2 billion people would have seen your story. So you have 2 billion impressions there, and maybe only 200 people saw that, or maybe 20 just saw that, or maybe nobody saw that, or maybe 5 saw that. So, but the 2 billion sounds like an amazing number, and every program is a success, because that's how the metrics are, which is true, and which is true in almost all organizations, because they don't have the money to say, why don't I finish a campaign, I go out and conduct a primary research and survey to see whether that really changed the perception or attitude of people, because they don't have the money and they don't have the time and they're churning campaigns after campaigns, and they're like, okay, now let's go to another one. Let's just look at this one now. This is hot topic, and this is and I'm not trying to bring forward the weaknesses and strengths of either or. I think it's just a discussion on what are some of the challenges I have seen in all these years, and I continue to see them in the industry. And one of the ways we are trying to just make that small difference is to say, let's just make sure to include some research in whichever way and data to guide our decision making better. And I think this example that I've just shared with you helps us not just track the media, but also, to Dr. Kent's point, say, how could we influence that? How could we be more proactive? If I know there is a media trend, I don't have to wait and be reactive about it. Can I just go out and shape that agenda, or reach out to a reporter who's consistently reporting on things and make a difference there?
Mhm. And Sarabdeep, I just spruiked your workshop that you're doing with IPR on measurement and evaluation. So I just put the link in to anybody who might be interested in registering. There is a academic rate, which is cheaper than the practitioner rate. And Sarab would be giving one of the presentations.
Oh, yeah, I'm actually doing a presentation on, thanks so much for that. I'm also doing a presentation on behavioral science. I'm doing a workshop on that. So absolutely, I would love to do a session for Dr. Taylor and Dr. Kent's student again, and also if you could join, I would love that. So thanks again.
Yes, it is online, Petra. Yeah, follow the link that I just put in the chat and see if that works for you. The time might not work, but it should be pretty good. There's great people doing it.
Absolutely. Sure. Any thoughts or any other reactions to this, or any other experiences that anybody wants to share, or research anecdotes before we jump into some fun behavioral stuff?
I would just add too that one of the things I've observed over the years is that communication is like a decade ahead of marketing and advertising in terms of our recognition of major issues. Like we think about engagement, we were talking about engagement for forever before it started becoming something that was popular, that everyone had to be engaged, and dialogue and other kinds of things. It's just that I think maybe because necessity is the mother of invention, and we don't have the resources and we don't have the ability to gather all that fancy computer generated data, that we have to figure out solutions to things using understanding what's going on in communication. But I just think, I always sort of joke that if advertising, actually understood rhetoric and communication, we'd actually have to be afraid of advertising. But they spend their time focusing on, did we sell more widgets, instead of the bigger picture, down the road. And so I just think that once we learn how to use this data, it really gives us an edge.
Yeah, no, absolutely. And I think one of the things that I have heard often with I would say the agency with our general practitioners is that they say that PR is often treated as a deli counter. They would just think that you would come and it needs more focus from practitioners to make it more strategic, which I think is definitely a discussion that I've heard oftentimes from a lot of people in all these fancy conferences and agencies as well. So absolutely want to highlight that. I don't know what I touched, oh, got it. Okay. I think one of the things that I also wanted to discuss today with this group is this research around behavioral science and how that's becoming so critical. And we are seeing a lot of positions in big organizations around behavioral research. And I would be happy to share, I have come across so many job openings of late where they would want people understanding of psychology and communication, but get into the titles are chief behavioral officers as well, or they have, some very senior people who are looking at behavioral science. And one of the agencies that really started working on behavioral science was Ogilvy. And they were the first ones to actually start looking at behavioral science from a comms perspective in an agency setting, and then really start looking at it. And there are few concepts which are becoming very mainstream in comms when it comes to behavioral science. And I thought it would be interesting to share at least two of them. One is a great experiment, which was done, which really talks about behavioral science and understanding what people do and what drives them to do things. And that's a very simplified and a great definition. I always think is amazing. When we think about neuroscience research, I think it's really starting to begin to connect some pieces between how the human brain thinks, how we behave the way we do. And one of the interests definitely is coming from the governments. The UK government has a very dedicated behavioral science unit that looks at a lot of the public issues, whether it's in health space, whether it's in general, to understand how they could really shift the attitudes and behaviors of people. And what is interesting is that there was a US executive order by President Obama back in the day where he really made it important that government agencies use behavioral science insights to better serve the American people. And the focus was how the policies and operations could really look at behavioral science and use some of the strategies or some of the insights from there as well. And I'm sure some of you would have heard about the concept of nudge, which has become so popular these days, the concept of nudging and how organizations are doing it, how marketing people are doing it. And that's one topic I thought we could probably discuss and share. And then there is a very interesting experiment that I want to share with you, and that's a real fun one. It was actually conducted by Paul Zak. He and his team really wanted to study the concept of trust. And the idea came from organizational research where more and more research found that CEOs and leaders are always struggling with the concept of trust in their organizations. And that really impacts employee retention, how that really impacts how that is a threat to organizational growth as well. And what interestingly Paul Zak and his team did was they wanted to study how trust could be really discovered through blood sampling. And they said that they would really, they set up an experiment online, and the experiment was interesting in a way that you had to send money to a complete stranger. And that meant that when you send that money, you could get triple the amount of the money that you sent back. Or you could lose the money completely. So it was absolutely up to the recipient that if you sent a $10, you could either get $30 back, or you could lose that $10 and every gain that came with that as well. And what they found very interesting was they actually hired people where they could draw blood samples before and after they sent the money to measure the level of oxytocin their brains produced, their bodies produced, and what they saw was that the greater money they sent to the unknown recipient, the greater the chances were to get the money back. But the less money they sent to the recipient, there were less chances to get that money back. And that really came from the fact that the more money you sent, the more trusted the recipient felt. And the more trusted somebody felt, the more likely it was for them to send the money back. But the less money you sent, the less trusted the recipient was, and it was less likely that they would send the money back because they would not feel trusted at all. And they actually did a placebo effect, and they did, did a couple of other experiments to make sure that it was not just a random thing, but it was actually measuring that levels of oxytocin. And the great thing about that experiment was that, after doing that experiment and replicating it and making sure, they came up with some really interesting findings for the organizations on how to develop trust in their employees. And some of the findings and some of the insights were how the leaders could be more personal, how leaders could give people more responsibility, because the more responsibility and less micromanage they would do, the more trusted the team members would be, and the more likely they would perform and they would do great. And this is an experiment that always interests me, because I really find this concept of trust so integral in organizations these days. And if you look at neuroscience, the strange thing about behavioral science and neuroscience research is that some of the media articles have really simplified, and people think that this neuroscience and behavior science research is just how your brain is wired, just the wiring of brains, and that's you oversimplify it. But when you start reading research and different concepts, like there is a prospect theory, there is a decision-making aspect in neuroscience, and then nudging for sure, which is so popular these days. But I think, and I'm happy to share this article. It was actually published in Harvard Business Review, and it was around the experiment that Paul Zak and his team did. But I thought this was fascinating, given how they could really study trust and really make it into a concept where they could use that and replicate into organizations and understanding that as well. So very, very interesting and very fascinating for anybody who's conducting research or who's trying to use trust as a variable in understanding organization and public and organization relationship, because there's a research there and how trust could be studied, and the article also gives you very straight measures on how you could use them in your survey methodology. So I can share that article after this, and it would be interesting for some of you to probably go through that as well.
If you want to send it to me, I can make it available for anybody who wants it down the road.
Okay, perfect. Okay, talking about another concept, which is decision making. I think this is another area which has got really interesting articles, interesting research done. And I would really want to highlight one thing here, and I would pause for a minute and let you guys decide which of the following scenarios would you choose and why. And probably we can discuss a little bit about the theory behind it and how that really is an integral part of behavioral science research and how marketing and comms people use that as well. So which of the following would you prefer, A or B? And
A.
Okay. What about, C and D?
No.
If you have to make a choice, which one? You have to make a choice. Would it be C or D? Okay. What about others?
As for me, the gambling is not good. So simply not involved.
Okay. We'll take out one person from the answering poll. Yeah. What about others?
Now, what's the downside? What's the downside to B? I mean, I got 25 chance of winning 1,007 chance of winning nothing. What do I have to invest?
You don't have to invest. It's just a choice you make.
B.
A.
What about others? What any other C and D?
I'll go with A.
D. Okay. And that's what, when you do this kind of an experiment or a question, most of the people would choose an A and a D. And it just talks about a theory called prospect theory, which was developed by Daniel Kahneman and Tversky. And it just talks about how when you give people the choice, people are always are risk averse, and they would always go with a certain degree of gain, and they dislike losses so much, even if it means it's to an equivalent gain as well. So I think this decision-making theory is what marketers use quite a lot. They use that to position, and they use that to communicate a certain gain more appealing than a loss. And that's where decision making is another area of research, and there's a lot more. We can't cover a lot of it today. And there is another concept called planning fallacy that says that how much expert you are, everybody thinks that they are a better planner than they actually are. And that's actually true, because you would think that you are a great planner, but that's just a fallacy, and that's not true. And behavioral science research really has studied decision making as a big part of how we as communicators or people in marketing as well could use this prospect theory, and how they could really showcase these choices in the communication messages that you draft, and in the marketing content or messages that you draft as well. So I just wanted to share this with you, because if you are looking and if you're interested in behavioral science research in general, I would say the concept of trust and decision making are two concepts among the many other concepts and theories in behavioral science that the organizations are really picking up on, and they want to understand more. So if anybody is looking for consulting for organizations, or anybody is looking for projects for organizations, and I would say nudging, for example, and what is happening with the COVID vaccine and the vaccine lotteries, a lot of that is again driven in behavioral science research as well. Any questions or any reactions or thoughts? And I wish I could read the chat, and just keep reading, but yeah.
It's
every
hard.
time it is hard, because you are doing the okay, never mind, I'll read it all together. Any thoughts, any reactions to that? I know we have like 15 minutes. And yeah,
I just want a quick question regarding this game theory. Is there any application or practical example that your organizations are currently working on or planning to do?
we don't have a lot of work underway to apply this decision-making theory, but that's why I'm saying that this is an area which organizations are now interested in. And I have seen and read a lot of articles, and when I talk to people in marketing and some other strategic areas, like we have a division of strategy, I definitely see that these two concepts, especially around how people make decisions, is a very critical thing for communicators to know, because ultimately when we are looking at behavioral change and how we could really move that needle to awareness, to attitudes, to behavior, understanding how people make decisions and how they would be averse to making and choosing losses over gain is a very critical way for us to apply that in organizations. We have not done it. I'm not sure if other organizations are doing it. And if they are doing it, they would not market it outside that they are doing it, because it's more of, again, a strategy for them, or it's more of the framework that they would base their comms and their campaigns on. So that's why I'm just sharing it with this group, that if anybody is doing research specifically around organizations and publics or behavioral science, I definitely know that decision-making and trust, and the concept of trust, is very critical for organizations, and they are absolutely interested in knowing more about how people, because every time you look at behavioral science, people say, why do people behave the way they do? But more than that, we want them to make decisions, and decisions that are in favor of the organization or the products or the services that they provide. And I don't want to get into the marketing realm of things, but a big part of when you think about communication, if we are thinking about public health, why would we want people to quit smoking and have healthy lifestyles, and what decisions they would make is definitely, again, an area where not just governments, but organizations and, other people would be interested in knowing as well. So I would say decision making and trust, two areas. Yeah.
There's a scholar named Brahms who has several books on game theory and some related stuff. He's got a book called Fair Division that goes into this concept of cake cutting and division that's used in negotiation and how people make decisions. Excellent text, easy to sort of read. And he also has this book on biblical games where he sort of does some interpretations of, of famous decisions. So he has several things. He's really approachable, easy to read, some really influential person. And then there's this assortment of logical fallacies in math and sciences about how people think about things like games of chance and their chance of winning. And so the hot hand fallacy in basketball or in sports where somebody, misses 10 shots in a row. And so the people say, well, they're due to make the next shot, or they make 10 shots in a row and they're hot, they're on a streak. And actually, statistically, it has nothing to do with either of those. They're going to shoot whatever their average shooting is. If they're shooting 70%, there's a 70% chance they make the shot. And so there's some stuff on that. I've got a couple New Scientist articles if you want a copy of it that talk about some of those issues. But both of those areas get at some of these topics that she's talking about.
Thank you so much. This was helpful. I know game theory, but definitely, and again, that's what I was saying. There's so many concepts in behavioral science research that if you start looking and reading prospect theory, decision making, the concept of trust, and then all those things, logical fallacies, and there's so many, but I just wanted to bring at least one or two, which I know that the industry is interested in, and they're making some, advances in understanding that. And that's a question when we look at some primary survey for our members, for our employees, we definitely want to know the concept of trust and how they would prefer and how they would choose our insurance or us as a provider over others. And that's again the concept of decision making for them and how they are viewing something as more favorable as compared to our competitors as well. Thank you. Any other questions? Any other comments on that? Anybody else have read something which is interesting along these lines that they would want to share with the group?
I'm learning one thing here that, this research can largely be divided into two parts. One is, your information-driven research where you're looking at, and then, there is this research which is based on, communication processes. You're trying to look at those communication processes, whether through behavioral science or, any other theory. So I just want to know, in an organization like yours, so that how are the decision makers looking at this aspect? Do they invest more in information centric research or research which is focusing more on communication processes and things like that?
It depends on two things I've seen. It depends on the budget they would have, but it also depends on who the leader is and how sophisticated their understanding is about things. If somebody thinks that information gathering is the only thing, they would not have the budget. But if somebody, and I have seen people who are really smart in a way that they understand research, or they would want to explore, or they would want to know more, or they would want to go a new route. And that's when they would really make sure that we have the budgets and we will have everything and the support and the structure to get things done. So I would say there is no either or. It depends largely on sometimes the need and sometimes the agenda from the leadership. When I joined my organization, we had a CEO who had a very different vision and view about communication. Unfortunately, he passed away at the age of 60. And then a new CEO came, and then he has a totally different vision about communication, and that's true for most of the organizations. And I have seen two very different leaders in the same organization with the same team, with very different visions and very different priorities around it. So I would say it really depends, and that's why if you have a research around behavioral science or any area that you're working on, and if you go to an organization, it really depends on the budget, but also the understanding and the need at times. So. But you're right, we're looking at research from not just information gathering, but also advancing, like all the concepts I'm talking about now. I'm not using decision-making research on a regular basis. I'll go in and quickly do a media trend analysis and see what the media is talking about, but I won't have the time and the budget always to go and say, let me just spend 6 months and study decision-making and come up with a framework that my company could use. And that's where concepts like trust, where they have studied trust, they have those reliable measures of trust, could be used in the survey questionnaire or a survey that we're already doing. And then we could really measure trust in our employees, our customers, our members. So I wanted to bring two perspectives. One is a concept which is really well studied in organizational research, the concept of trust. And this decision-making is a great area, because ultimately we want to understand why humans make decisions and why they make the decisions they make. So that's an area where I definitely know would have great opportunities and great ways that you could probably bring some perspective there. Perfect. Thank you so much. And then,
thanks.
Yeah.
Nudging for good.
I know, nudging for good. And that's an area I think most of us understand. Most of us have read about articles. I shared some, I think 2 articles with the group around nudging as well. And it's a area that Richard Thaler and Sunstein really talked about, that what nudging is doing is it's giving a choice architecture to people that would alter people's behavior in a way. But most importantly, you are creating those interventions that are easy for people, and you nudge them in the direction that you want to nudge them in. And there are numerous examples of how this concept, which has been so well studied in organizations, in marketing, have been used. And I have few examples here. For example, this is one of the examples where changing plate sizes in the Google cafeteria really helped with food wastage, would help with healthy lifestyles. And all they did was they just in their cafeteria switched from a large plate to a small plate, so that when their employees would go, and that's the message it said, you're welcome back again and again, and you can visit our buffet as many times, but that's better than taking a lot at once and wasting the food and leading to unhealthy lifestyle as well. There are numerous examples of how different supermarkets just simply added some green arrows, and it said, follow green arrows for your health, and it led them to the produce aisle. And within 2 weeks, they saw that the produce aisle's sales was up by 10%. So it's just those small changes and the choice architecture that organizations are giving. And then there was an example of a very small restaurant which said, which really highlighted, and it said, we have a fish entree at $35, which was absolutely overpriced for the menu. But the nudge it was giving was, it was actually not interested in selling the fish. It was actually a decoy for people to choose other options which were profitable for the restaurant but looked less attractive to them. So there are numerous examples where organizations, smaller or big, are really using nudging for good. But that's the belief, that you have to nudge for good, you have to nudge for better. It's not for profit, it's not to decoy people. And that's an ethical, and there's a big ethical debate about nudging as a topic, because it's about, are you nudging for your benefit only, or is it for the larger good? And there's another example here where the default in an organization was set up on print on both sides. of the paper so that the paper consumption would drop, wastage would drop, and it's just a default option. And it goes by the fact that people are so used to going with the default option that they would just not change until they put their thought behind it. It's very natural for us to just do the things that we naturally do, and it becomes a default for us. For example, another company automatically enrolled new employees in its retirement savings plan until they opted out, and the enrollment went from a 60% to a 90%, and there were like big shifts there happening. And I can go on and on with the examples of nudging, how companies are doing it. There's a small city in California, San Ramon, and they saw that a lot of their electricity bills were over the top. They were not normal, and it was not just in summers but in winters as well, because it doesn't get so cold here as well. So what they did was, when they sent the electricity bills, they added a letter which said that on an average, their neighbor's bill was this much lower than them. So it was a way to nudge them to say, this is what our neighbors are doing, and this is what we could do. So as I said, nudging is another big area in behavioral science and in comms as well now, where organizations are really using this choice architecture as a theory, as a framework. And it's not a theory, but it's more of a framework that, and I hope Dr. Kent would be proud of me if I say it's a theory, we'll end up in a different discussion. So it's a framework mostly where the nudging as a concept is being used to develop messages and really help get to the decisions that the organizations want to decide. So I think nudging, as it's based on a principle that everyday decisions and behaviors are not often rational and conscious. So, and it also says that it's legitimate to influence people's behavior to make their lives healthier. But this should not be but such intrusion should not be compulsive. It should not be a compulsion, and it should be ethical for sure. So there are few
Can I ask a question?
Sure.
So I've been actually, I work with the WHO in Geneva on COVID-19 and other health issues. And we've been collaborating with the Behavioral Insights unit. And they make the argument that communication doesn't matter, that people make decisions based on, as you said, irrational reasons, and that the communication doesn't matter at all, that actually it's this psychological gut feeling response to economic stuff. So what would your response be to that communication doesn't matter because we don't know why people make the decisions we make? All that we learn from BI is what triggers them to act in the way that we want.
I would definitely, my first thought to that, Dr. Taylor, would be that even if people, and absolutely people make irrational decisions, and they are not, they make these decisions, but all the decisions that they are making is coming from the biases they have and the information they gather. So that information gathering is absolutely coming from the messages that the organizations and the government and everywhere that you could see. So I will definitely say that looking at how and I think this was a discussion almost 2 years back, that people have so much attention span, companies are overcrowding the space, they are giving too many messages, but you'll be surprised that that discussion has now shifted to saying that's fine. People are used to consuming so much content that they don't want to just read one source, but they would go to multiple sources to make sure that their biases stick to what they want to believe in. And I think that's where these conspiracy theories or anti-vaxxers and all those discussions then come in. But I would disagree that communication doesn't play a role, because all that you're getting your biases or your information to strengthen your bias or to change your perception comes from that communication. And that's where we as communicators are we are doing such a big piece of that vaccine hesitancy part. And I remember that, when we were making those comms campaign, a lot of our FAQs and questions were, and we did research to say, one of the concerns for anti-vaxxers are vaccines were rushed, so they are not safe. So one of our answers or our campaign was, it was not rushed. It was a process. This is what happened. The second question was, this is what, it would give you the real, so we really looked into all those messaging to counter and develop those communication to create that nudge in that positive way. So I don't know what they're thinking, and I would have thought they would have thought otherwise, but yeah. Dr. Kent has.
Well, I would also add the third reason action does say that people will make the right choice if it's within their power. So the idea that people don't want to choose is sort of a cop-out, like that we just act on whatever's in front of us. We will if we're given the nudge helps give us the tools, helps point us in the right direction. And just on that earlier point, there's a whole area called heuristics and biases and decision theory research. So again, if that's of interest, just do a search for heuristics and biases and you'll find a whole ton of research on that area that talks about how we are cognitive misers and people don't want to have to think too much about things. So we rely on heuristics and biases to help us make decisions. So our ability to shape those then can make people make different decisions.
If I may, the other issue that people should be sure that that the change in behavior gives them some value, because sometimes, especially government agencies, they cannot communicate the value to their audience because they wanted to just to give them orders. You should do this because we want you should do this. But everyone, I mean, each participant of target audience, he or she should be aware of what will be the value if I will vaccinate it, or if I will, I don't know, quit smoking and so on. So you should communicate this value. That's very important. And I don't agree with you, Dr. Taylor, that the communication doesn't matter. The communication gives a framework. So of course, people make irrational decisions, but we as a communication can create a framework where these people will make this irrational
And I always fight against that because they say communication doesn't matter. It's these gut instincts. And I always argue communication constructs our social reality. Of course it matters. But BI is like, nah, no, you don't know why they're doing it. All you want to know is find the prompt that triggers the behavior that you want.
How are they finding it then, Dr. Kent?
What was that?
How are they finding it? Dr. Taylor said they're trying to find the prompt that makes them, are they doing anything to find that prompt?
The great example is the UK doctor's appointments. You know that the UK was wasting millions a year of pounds of people who missed their doctor's appointments, and they used BI to say, they tested like 5 messages, and the one that worked was cancel, accept. And the cancel then allowed people to get out of the appointment they didn't want, thus not charging the government for the meeting. But the other one's about, every time you miss, it's 50 pounds to the government. None of those worked. But the minute you gave them the option of accept or confirm or cancel, that's when they started seeing actually the numbers. But it's like throwing jelly at the wall, right? They tried so many different things. Because they were using theory, right? They were trying to do the economic theory, a variety of theories that they used, but that's one that they found worked, giving people the power, right? It's back to Dimitro's idea that people have choice, and Michael said, making them give like they have a chance of making a decision, cancel or approve or agree. So I don't know, we're working with them, but the important thing too is that BI is about communication, because once you know what triggers the behavior, then you can actually start communicating about it, adding it into your messaging, and then you can start seeing the results grow.
Perfect. That was the end of my presentation, but any other questions or thoughts?
That was good.
Perfect. Okay. Thank you so much for inviting me, and
Thank you
thank
very
you so
much.
much for listening to my presentation today. I think the agenda for me was just to make sure it's a discussion and I could bring a perspective on how we are using research, how I have seen comms research shift all these years or not shift in some times, and then absolutely behavioral science research, because this is becoming so important for comms from the work that I'm seeing these days as well, especially in healthcare.
I think there's also so many places not doing this. Like what you described, we teach our students about the importance of research and the importance of finding out all this to make good decisions. And there are a small percentage of excellent organizations out there that do it. And then there are just so many organizations out there that don't do it at all, that it makes you seem like you're special, when in fact everyone should be doing this.
Yeah. And I think I definitely, I really mean that when I say it, but a lot of the credit goes to good professors like you, because that's something which, when you are teaching students, that becomes so integral to the way they practice public relations. And I really think that my base with how you taught the dialogic and that strategic comms was so integral in the way I thought about communication in any role that I've taken. And that's what makes me unique in an industry, and is really something I think is a way I'm giving back to the community as well.
Tell that to my students.
All right, excellent.
Okay.
Thank you so much.
you.
Have a good
coming,
rest of the
everyone.
evening. Bye-bye.
Thank you, Sarab. That was fantastic. Now, I only have one request for you, and I know it's going to be very difficult, but you have to start calling us Maureen and Michael.
I'll try. It's just so hard for me to do it culturally.